Hello, welcome. I'll just wait a moment while people enter. Welcome, thank you for joining us. Bienvenue et merci de vous joindre à nous. Pour ceux qui parlent français, for those that speak French, avant de commencer, je tiens à vous informer qu'une traduction simultanée en direct vers le français est offerte pour la séance aujourd'hui. Vous pouvez trouver le bouton d'interprétation au bas de votre écran. Si vous cliquez dessus le bouton d'interprétation et sélectionnez le français, vous pouvez activer les sous-titres en français aussi. Veuillez d'abord activer la traduction et puis cliquer sur le bouton des sous-titres pour un affichage plus précis en français. Merci. Je vais mettre la direction dans le chat aussi. So you can turn on the French translation using the button at the bottom of the screen. And I will put a short direction on how to do this in the chat as well, for those who need it. Before we begin the session, I'd also like to take a moment to acknowledge with respect the Indigenous peoples and communities whose enduring relationship with the land continues to this day and on whose traditional territory our work takes place. We invite you to share where you're joining us from, and you feel free to include the territory or treaty in the chat, as well as the organization, foundation, or institution you're associated with if you're comfortable doing so. My name is Ari Campbell, and I'm the program manager for the Healthy Capital Program with the Canadian Coalition for Green Healthcare. On behalf of the coalition, I'm happy to welcome you to today's webinar, Sustainable Investing Trends for Canadian Hospital Foundations, Addressing Barriers and Seizing Opportunities. Throughout today's session, if you encounter any technical issues, please let us know using the chat. If you have any questions for our presenters, you can use the Q&A box at the bottom of the screen. And our panelists will be answering questions at the end. We're also recording this webinar, and it will be sent to all registrants and posted on our website and YouTube by next week. This session is hosted by the Canadian Coalition for Green Healthcare in collaboration with the Trottier Family Foundation, Peach Health Ontario, the Canadian Climate Law Initiative, and Quinn+Partners. First, I'd like to introduce our incredible team of leaders in sustainable finance, healthcare, and philanthropy. First, we have Dr. Miles Sargent. He's the Executive Director of the Canadian Coalition for Green Healthcare. He holds multiple roles at McMaster University, including Postgraduate Medical Education Director for Sustainable Healthcare, Assistant Clinical Professor in the Department of Family Medicine, co-founder and co-lead of Peach Health Ontario. Dr. Sargent is also lead MD at the Hamilton Family Health Team's Green Initiative and president of Trees for Hamilton, among many other contributions to greening Canada's healthcare system. From the Trottier Family Foundation, we have Flavie Desgagnés-Etier, an expert in corporate social responsibility and climate-focused philanthropy. She's also a lecturer at the University of Montreal. The Trottier Family Foundation is the Healthy Capital Program funder and has made historical grants to projects and programs to mitigate climate change. And for the bulk of our presentation today, we will have Francisca Quinn, president and founder of Quinn+Partners. She brings 25 years of experience in sustainable consulting and driving impact through responsible investment. And finally, we have Rosalie Vendette, director at Quinn+Partners, a responsible investment expert with over 2 decades of experience helping asset owners integrate sustainability into their strategies. And without further delay, I'll hand it over to Flavie for opening remarks.
Thanks so much, Ari, and welcome everyone. Thank you so much for being here. I'll stay brief in my remarks, but I just wanted to take a moment to stress how important this moment, the moment we're in, and how timely this initiative is. So, as you all know, we're right into a tariff war, and the level of anxiety about the economy is higher than any time in recent memory. We're in times of uncertainty, and that makes market highly volatile. So on one hand, the economy is shivering. On the other hand, scientists are warning us that the 1.5-degree trajectory is soon to be impossible to achieve. Some regions are actually becoming uninsurable because the premiums are exceeding what people can afford to pay. Just last week, a board director of Allianz, an international insurer, declared that climate change is threatening the very foundation of our financial system. So the physical impact of climate change aren't what it used to be, a long-term risk. The time frame is actually shortening. And so on that note, that very positive note, I'd say, more than ever, as asset owners, as investors, integrating responsible investment practices doesn't only reflect our values. It's about value. It's about financial returns. It's about fulfilling our fiduciary duty. Hospital foundations are among the most trusted institutions. They are guardians of community health, stewards of long-term investments, investments that need to reflect their mission, because this is about reputational risk as well. Investing in something creating health problems that hospital foundations are trying to solve with granting activities can pose a significant risk and even affect their license to operate. So with this project, the Healthy Capital Program, we want to give boards, the hospital foundation boards, the tools, the knowledge, and the confidence to make future-focused decisions. And as you'll hear more about it today, we're already seeing that many foundations are ready for this conversation. What's needed now is not perfection, it's momentum, thoughtful steps grounded in evidence. So I hope you'll enjoy this webinar, and please don't hesitate to get in touch with any of us if you're interested to know more. And on this note, I'll pass it on to Dr. Miles Sargent.
Thank you so much, Flavie. And as Flavie said, thank you all for coming today. It's such an important topic. Yes, I am a family doctor in Hamilton, and I work both in outpatients and also within Hamilton Health Sciences. I work very, very part-time now because I am the executive director of the Canadian Coalition for Green Healthcare, which has actually been around since 2000. Imagine that. There was an organization in 2000 looking at the greening of the healthcare system. I invite you to read this over. I'm not going to read it to you, but I'm just going to summarize by saying that our goal for this project is simple. We are supporting hospital foundation boards in incorporating ESG into their investment strategies. And of course, ESG stands for environment, social impact, and governance. And we believe that point two there, that this upholds their mission of promoting health and well-being. Next slide. So in these presentations, I often get asked the question, what is a guy like you doing in a place like this? And so I like to address it early so it doesn't become a question at the 20-minute mark. The healthcare system, incredibly, in Canada contributes 5% of all the greenhouse gases, 5%. And I mean, that's including everything. That's including the cars we drive and the houses we live in and all the industry. In what we now call the global north, healthcare systems generate a lot of CO2. So in our very course of business within healthcare, we generate greenhouse gases, which in turn, as we know, harm us in terms of global warming and climate change. I do understand there's a difference between an operations board and a foundation board, and we obviously talk to the operations board as well as the foundation board. This slide here is actually from the US, but it's from a public health system within the US. And this is showing of that 5% footprint, what are the pieces of the pie? And if you look at 10 o'clock in orange, you will see transportation, 4% there, but there's other contributors to transportation. Let's call it 5%. Transportation, 5% of this pie. We have been talking, look, I remember my parents buying a small car in the 1970s because of the problem with transportation and oil. This has been a topic for a long time. Again, I live in Hamilton. We have lots of bike lanes. Sadly, we don't use the bike lanes. This is a really tough little piece to make smaller. So what are the big pieces? Well, you can look at the top in blue. That is supply chain or procurement. And we're actually doing a lot on that front. This is all the stuff that we buy. And in fact, the Canadian Coalition for Green Healthcare does have a partnership with Supply Ontario. And indeed, the Ontario government is interested in buying locally, and for all the great reasons now, because of the American government, we need to buy locally. So that's happening. So then we look at the green piece at the bottom, which is our investments. Now, we are not going to get these investments to zero, but this is a huge piece of the pie, the investments that we make contributing to CO2 and climate change. This can be decreased down by about 2/3. There is no perfect investment, but this can be significantly reduced. Next slide, please. So there are 3 phases to our project. We've pretty much completed phase 1, which was our survey, and thank you all for replying to the survey. For those of you who did not get an opportunity, we still invite you to fill it out. All the more information is better, so just let us know if you want to do that. So we're moving into part 2 now, the green section here, which is developing a community of practice. We know that foundation boards have a duty to make money and be wise about the assets they have. And we want people to move along in a safe way together. So we are developing a community of practice. And finally, there may be some opportunity for personalized support. And on that point, I'm going to pass it to Rosalie.
Thank you, Miles. Happy to be with you today and sharing these results. Before we get into them, just wanted to introduce a bit about the survey and about what we're going to learn today. So we hope that by the end of this webinar, you'll have learned about integration of environmental, social, and governance practices, considerations into investments into the management of Hospital Foundation's capital. So we'd like to explore with you some of the trends in sustainable investing, some of the common barriers and challenges that are connected to integrating these considerations, but also opportunities and some of the best practices that exist and are exhibited out there for advancing sustainable investing. We'd like to finish up with specific suggestions, concrete next steps on how you can move, either if you're at the beginning of your journey or if you're already along this integration of sustainability journey. So a bit about the survey. We contacted 78 foundations with an online survey that contained 27 questions. And that ran from December to January. And we did compile the results, anonymized, of course, in February. So what you see here, what you will see is a summary of those results. So before we share some numbers, on the next slide, what we wanted to do is take a brief pause to make sure that we level set here and everybody on the webinar shares the same understanding. When we talk about ESG, so Miles referred to environmental, social, and governance consideration, we also say, it's quite a synonym, sustainable investing. We're talking about integrating some considerations into the management, the processes that is along your investment life cycle. So you can think of that at the beginning when you're looking to invest. So the investable universe, the investment decision, the investment thesis. But we're thinking about that also throughout the holding period as your active owner of securities. So what are your practices? And what are the beliefs that are at the foundations of this, oftentimes found in an investment policy? So sustainable investing is very much about enhancing traditional asset management. So you can think about this as looking at the broader spectrum of risks, resulting in a deeper insights, especially when you're looking at the long-term horizon, but also a way to align your practices with some of your stakeholders' expectations, with what some of the evolution, I'd say, in investments practices that are now common practice, at least in Canada. And so when we're talking about ESG consideration, you might wonder, well, what is it about? So the panel on your right-hand side gives you some examples. Environment, of course, leads to climate. So how are my assets protected against potential risk because they're being exposed and can lose some value based on actual physical events, such as hurricanes and flood and things like that. And the list could go on and on. I think that for some of the leading practices, sustainable investing can also refer to impact. So how can I have more impact with my investment with targeting, and this is leading practices, targeting specific topics that can then transform into investment strategies. But we won't touch on that too much. We'll stay at the foundational level. Thank you, Harry. So first, we'll look at the respondent profile. So as I said, we did send the survey to 78 hospital foundations. 33% of them responded, so very good response rates. And you can see on the right-hand side the representation of those foundations by asset size. And so good representations on pretty much all level, especially when we go down to 50 million to 100 million and 100 million and more. When we look at and compile the total asset under management of most of those 78, so we have the top 70 Canadian foundations in importance, I'd say, and those top 70 represent 9.6 billion, so close to 10 billion of asset under management. And when we isolate the respondents, it's close to 60% of that pool of capital that's answering here. So the takeaway is that the survey respondents base is very representative of the top 70 foundation, and we probably have some of them on the call today. Let's go to the next slide to explore their profile further. 2/3 of the respondents are located in Ontario. And we think that this aligns with the geographical location of most of the Healthy Capital representatives, partners, and networks. So connected essentially to the outreaching effort, but we had coverage throughout the entire country from coast to coast to coast. And when we look at the chart on the right-hand side, if we add the asset under management that's 50 million and over, we see that 69%, so close to 70% of the respondents are in that higher range of asset under management. So we're indexing a bit more over larger pool of capital, but regardless, we think that the respondents are still representative of the large base of Canadian foundations. If we go to the next slide, before we deep dive into how the foundations are structured in terms of investment model, we just wanted to explain what the various models are out there. And this, by the way, is not specific to a hospital foundation. It could be more of an institutional investment approach. So if you indulge me into describing for just a few minutes, if we go to the left hand side of the panel, externally managed, this is a model where a foundation will look at outside asset managers to invest on its behalf, and will do so by selecting them and giving or sharing instructions with them, instructions that are located in the investment policy. So if we go to the other end of that table on the right-hand side, you have the opposite model where it is completely internally managed, meaning that the foundation would have employees, staff members that are making the individual investment decisions. And of course, the foundation is still responsible to adopt the investment policy and selecting the staff members. And then in between, we have different variations. So the hybrid model is a combination of part of the assets that are externally managed by asset managers and other parts that would be managed internally. Let's say you have a team of dedicated investment professionals that are specialized in investing in bonds that you have internally, but you have less of that expertise for equity for the other asset class, so you give that out to an investment manager. And then we have the outsourced Chief Investment Officer, OCIO, the acronym. So it's a model where you not only rely on external asset managers, but you also hire an external Chief Investment Officer with whom you'll share some of the investment instructions. And that firm will also help you select, or will make the selection of asset managers on your behalf. So one of the key takeaways is no matter what model you decide to have, the foundation board is still very much responsible to adopt the investment policy, or essentially outlining the way that the capital will be managed, how it will be divided in asset allocation and various assets, and what are the parameters of that investment management. So I'll pass it on to my colleague Francisca for a bit more explanation on how it reflects with the survey responses.
Exactly. Yeah, so I'm going to be speaking about what we found out in the survey when it comes to current practices with regards to how hospital foundations integrate ESG or climate considerations. I'm going to be talking about how they make decisions first, and then we'll speak about what is currently considered when it comes to environmental, social, and governance considerations. And I'll speak about what some of the drivers are and have been, and still what some of the barriers are that still exist. And that's what's going to put us nicely into next steps later on in the presentation. But when it comes to the investment models, through the work that Rosalie and I have been doing for many years, when it comes to helping investors integrate ESG and climate considerations, we very much know that it's the model that helps to dictate how you can embed considerations. What we found out in the surveys currently among hospital foundations, majority is indirectly managed, 69% through external managers, 19% through the outsourced CIO model. We also found that 12%, and this is largely the largest foundations, have a hybrid model where they make some of the decisions within the foundation or the foundation's investment committee. No survey respondents indicated that this is a process that takes place solely within the hospital foundation. And because these 88% where they outsource or they have external parties that manage the capital out of foundations, it is really about how you as a foundation can influence their actions that is the key to start this journey. Next page, please. So this is a slide that really shows the different parties that influence how investments are being done. So at the center, we have the hospital foundation, board of directors, many times, but many of the foundations also have a board investment committee that tend to get in more into the details and make recommendations, but they're also influenced by external parties, an investment consultant, investment advisor, and can be supporting the capital allocation. And also the selection of asset managers. And they also, many of the larger foundations and hospitals also have internal staff that supports. So the board of directors will adopt an investment policy. And the investment policy gets really delegated to either, if you remember the investment models, the external investment managers or the OCIO office. So this investment policy is a key governance tool and how you can influence not only the type of investments you like, but risk and return parameters, but also if you would like your investment professionals to also consider certain environmental, social, and governance considerations. I want to note that with other institutional investors, pension plans, asset managers, many of them will also have a supplementary, complementary ESG policy as well that works in conjunction with investment policy. Next slide, please. In the survey, we asked who participates in the investment decisions, either the investment decision to select an external manager or external managers, as well as funds. The primary decision maker, obviously, will be the board and maybe the board investment committee. We also noted that 96% of respondents, or pretty much all of the foundations, do have an investment policy and guidance. But it's really at the foundation level, the board and the board investment committee who is the primary decision makers. But there's a lot of other parties as well, as we learned, who influence. So we have external advisor and external investment professionals, 43% respondents indicated, and also internal staff too, 32% respondents indicated that. So this really suggests that there's a variety of stakeholders who have a say, and you need to align all of the stakeholders, and hence going back to this governance tool, which is the investment policy. So just another example of how kind of governance takes place. We wanted to know in the survey, and next slide, please. We wanted to understand currently in the investment policies that the foundations have, currently, do they incorporate considerations for environmental, social, and governance, or sustainability in the investment policies? We found out that about half of the foundations currently have consideration for at least one ESG factor, and some have multiple. And we also learned that there's currently about half of the foundations are talking about sustainability in the capital invested, and also about half feel that they have knowledge or expertise, at least from a board or a staff level. So this is all really, really positive. But there's 46% that currently does not have ESG factors as a part of the investment policy. They do not give instructions then to their external managers around looking at this from a risk and opportunity perspective. And just taking a step back into the kind of the broader industry, today, most pension plans in Canada will have considerations for ESG factors in their investment policies or in a supplementary ESG policy. We also know that many of the larger family foundations also do that, and the majority of asset managers. At the macro level in Canada, the Responsible Investment Association do a survey every other year when they look at industry trends. And in the latest market update, 71% of all capital, so this is by all the capital that gets invested in Canada by institutional investors, do consider ESG. So one could say that there's maybe a little bit of a lag from where foundations, hospital foundations are right now compared to the overarching investment industry in Canada, if you like. And we also asked in the survey on the next slide, what if climate is considered in the investment policies? And we found out it was that looking at climate risk, 71 of the respondents do not currently look at climate risks. We also had a slightly different questions asking about if there's a process for how you integrate climate-related risk and opportunities in either selection of asset managers or particular investment decisions, and that was about 80%. So there's an opportunity here to look at closer into how climate risk is embedded. And then there's also kind of zooming out a bit, we know that in many countries, including Canada, central banks, financial regulators, even the Financial Stability Board has recognized that climate change is a material risk for the financial system as a whole. And hence, there is also, many of these parties already have to report on climate risks and the process for managing it. So there is quite an opportunity here to embed climate as a part of considerations in capital management for hospital foundations. And I'm just going to just comment a little bit about what has been driving the process to date and where we are currently. We asked about drivers in the survey, and we learned that about, again, half of the boards have been discussing ESG considerations and climate. And this is driven by a variety of different drivers. Probably many board members are part of other boards or organizations where ESG considerations are part of corporate strategies. We saw the wider institutional investor landscape, so industry trends. We've also heard that many times major donors are also asking the foundations for how sustainability is being considered in the capital management. The other stakeholders, community members, hospital staff, as well. And so we believe that for foundations, having an active dialogue and asking stakeholders about their drivers will help to stimulate discussions. And really, this can be a way to move forward. And a part of this project is to have the tools in place to look at what is material and what can matter. And finally, just an observation about the barriers to advancement. So primarily, it appears that there is a lack today of awareness and knowledge on how considerations for sustainability factors can help both with risk and opportunities for the capital investor. There is a little bit of it looks like from these numbers here, on uncertainty really of the business case. There could be some preconceived notions around maybe this is actually negative for returns. Maybe this is not consistent with what we have to do as fiduciaries. So the lack of external expertise comes in. Maybe uncertainty if our existing managers actually have the data or suitable products to incorporate that decision. So again, appears to be an opportunity here to move forward with awareness raising and knowledge. And again, this is very much the purpose of this project, is to make these tools available. And just speaking from Rosalie and our expertise, the good news is that pretty much most large and reputable, and even the smaller ones, asset managers in Canada, they actually do have the expertise. Many have internal teams that support the investment teams and the fund managers on looking at this. And I think that most of these would be delighted to hear more from their foundation clients about their preferences and how they can be better stewards of their capital. So with that, I'm going to hand it back over to Rosalie to share a few more remarks around this. Thank you.
Thank you. So in addition to the drivers, the barriers, and the describers of practices, we asked in the survey what kind of support Foundations Board would be interested in, could benefit from. And we're showing here the responses that are throughout very important, because all of the items that were listed here have gained 50% or more support. So by importance, and without surprise, Foundations Board, the first item was directly connected to the business case. Better data on the financial impacts related to the integration of environmental, social, and governance factors. So looking for information on how to connect the dots between the investment products out there, the merits of integrating sustainability in investments. And we think this is connected also, of course, to the second item, which is has to do with the legal fiduciary duty, so the duty of care, and sort of the legal validation of integrating sustainability. We know that there's been lots of myth and uncertainty. Is it part of the fiduciary duty? Is it not part? And there is, of course, knowledge out there, studies, reports that do specify and explicitly confirm that it is part of fiduciary duty, but this understanding needs to get out there more and be adopted, and the clarification need to be brought to the foundation board. As a third item, access to case studies, so examples of how peers are doing it. So we hope that this short webinar on survey results can help with that. And of course, there's probably more that can be said about what others are doing in Canada. We know, again, that there's examples that are out there. I think it's probably just a matter of getting those story told and having those testimonials and those organizations share what their journey has been. Another item is training, and the last one is access to tools. So tools that would be supporting hospital foundations board on their journey. Could be templated policies, templated language, such as due diligence. What kind of questions can I ask when I am about to select an asset managers, or what kind of question can I ask when I'm in a relationship with an asset managers to kind of monitor what they're doing on the ESG front, on sustainability front. And the good news is that all of those can be addressed by the Healthy Capital Initiative. As Miles was saying at the outset of this webinar, there's a phase 2 with board awareness presentations, education presentations, and there will also be a community of practice for those interested that will be put together, where we will come in, the group that you see here, to support with the creation of those tools that can be later on accessible to the entire community. So feel free to reach out. If we go to the next slide, we wanted to end the survey results with a little bit of an appreciation of where, when we group all of these responses together, what we believe it tells us about the journey that the hospital foundations are on. And so we'd like to bucket, this is a quick maturity assessment, if you will, to bucket the hospital foundations into 3 categories. So we believe that based on the responses that we've seen, about 1/4 of the respondents have not begun their journey. So they're either at the very beginning, haven't had the conversation, in the investment committee or board setting, not really sure that there's anything, no instructions, no specific language in the investment policy. Then we believe that pretty much half, or a little over half, of the respondents are at the beginning of their journey. As Francisca was sharing, there is ESG consideration in the policy. The foundations have started doing a few things, but probably room for improvement, given when we see the shift between the ESG and then no specificity around climate. Still lots of barriers. So we think that the bulk is there at the beginning, and then about 1/4, close to 1/4 of the respondents that are in the progressing stage, meaning that they've begun their journey, they've actioned many things and evolved their practices to integrate sustainability in their consideration. But this is, as I said, a short maturity assessment. We tend to do bigger ones where we explore all the various practices, but of course, using confidential information when we get in and we look under the hood, sort of thing, so to speak. So that is pretty much the end for us. We'd like to leave you with a few takeaways. So I think that the survey response demonstrate that there's a growing interest for sustainable investing, with many foundations that are beginning or are on their integration journey. I think it was visible that the investment model kind of plays a role, and since the majority is externally managed, there's a lot of embedment of sustainability in your decision making that's will be enacted or implemented by your asset managers and the various investment professionals. So the need for clarity around the instructions that how you want your capital to be managed. There's opportunity to further the integration, but we understand that there's many barriers, such as lack of expertise and concern for financial return. So hopefully the remainder of the program, the Healthy Capital program, can address some of them. So if you are at the beginning of your journey, if we go to the next slide, we wanted to leave you with a few simple steps you can consider to begin your journey. Start by having a conversation. This is by far one of the drivers that was coming out of the survey results. Having a conversation, where is the foundation? Where are board members on this? Maybe have a conversation that's a bit structured with taking what's out there in terms of information, knowledge. There's a ton of resources that are available on websites on the web. So maybe use during that conversation this opportunity to present a comprehensive case for what are some of the drivers, so that the conversation can touch on these things and clarify that business case with the financial returns. So there's the conversation is not driven by myth, but rather by fact and information that's factual, that's out there. And hopefully this, as a first step, will drive to integrating sustainability consideration in your investment policy, be it an additional step, or as Francisca was saying, some out there adopt a sustainable investment policy as an aside document or an appendix or a complement. If you are already on your integration journey on next slide, and you want to continue further, what we see out there, institutional investors doing, foundations, is to define commitments. So yes, you've said you integrate ESG, but what about climate and in your beliefs? Do you have any directions where you want to go and address specific risks, determine some objectives, and how this will manifest itself in the implementation? And then engaging your asset managers so that you're aligned, because ultimately they are, for most of the respondents at least, they are the ones that will implement. So how are the instructions clarified so that you know what they're doing, they're reporting back on what they're doing on your behalf, and how specific are you when you're hiring for them to have the skills and expertise and the investment product at your disposal. And of course, prioritize transparency. I think that nobody expects us to be perfect, but there's probably a lot of stakeholders that will appreciate learning more about your integration journey and this actual steps you're taking and some of the results that you're able to obtain with embedding sustainability in your investment practices. And with that, I'll hand it over back to Ari for the conclusion.
Okay, thank you so much for all of our speakers. We'll be diving into questions shortly. If you've heard all of this and are wondering how to access help or receive support from Healthy Capital, then we're definitely here to assist you with that. I do want to make a note that all of our support is free, confidential, and fully funded by the Trottier Foundation, or the Trottier Family Foundation. And we'll have a couple options as well available for that kind of support. So you can stay informed about upcoming education presentations, as well as our community of practice, to join peers and receive kind of that personalized support and to co-create those open source tools and gain access to more resources. I'll put a link in the chat for that contact list. So you can sign up, you'll receive routine updates from me. You can also contact me directly if you'd like to schedule a conversation or just an informal intro meeting with yourself and your team. And we're currently booking free and confidential board, team, or investment committee presentations as well. So if you don't know how to start that conversation and you want somebody to support you in that, then that's something that we can do. You can put in, if anyone has any questions, you can put them into the chat or the Q&A. And then as we kind of wait for to see if there's any questions, I have a question for the Q&P team. And so I'm wondering, in your experience, what has been the most effective approach to starting the conversation about sustainable investing at the board level? Like, how can you ensure that it leads to meaningful action?
Maybe I'll start, and then maybe Rosalie will supplement. In terms of how to start the conversation, one idea is to kind of go back to the basics and really, what are our beliefs as a foundation, and what are the impacts that we are trying to achieve, and what are some of the things that we would not like to achieve through our investments, and maybe an informal discussion. It can be grounded in rational things around what creates risk, but then also maybe personal beliefs as well, and what makes sense. You may want to look at some of the areas in which you try to grant and do funding for already, and see what are some of the factors that could be material and play into that given. So that could be one of those steps.
And
Yeah, maybe I can add that I think that what we've seen in some instances are, discussions that are prompted by donor asking, what do you do? So maybe instead of waiting to be confronted with those maybe difficult questions, because you never know, it's probably best to have room for a conversation that's not rushed, because it rarely takes only one board meeting or one investment committee meeting. Learning about this takes a little bit of time. And what we've seen is paying attention to not go into the personal values. So this is oftentimes a challenging conversation where some people might have personal values. So we, when we guide organization, we try to stay on what's out there in terms of evidence and what are the practices that are out there. So maybe one point of reference that people can consult is the actual Canadian Association for Responsible Investment. Another point of reference is the guiding principles of the Responsible Investment Association. It's Responsible Investment Association, PRI, Principle for Responsible Investment, is an international association with over 5,000 members. And it's essentially representing more than 50% of the entire pool of capital that's managed around the world. So all the major institutional investors, pension plans, and sovereign wealth funds have agreed to this. And with their annual dues to the association, tools are being created. So there's a lot of things that are out there that can help support the conversation.
And a question that's come up before when we've been speaking to Hospital Foundation board members is how to like maximize people's time, and how Hospital Foundations can embed sustainability in passive strategies.
Want to get that, Francisca?
Why don't you start, Rosalie, this time?
Yes, of course. So I think to make sure that we're all in the same understanding, passive strategies are investment products or investment strategies that rely on replicating an index. So a pool of already selected securities, oftentimes we'll refer to shares of companies, and very well, S&P 500 can be very well known as an example. So you opt for a product that kind of replicates. We say it's passive in a sense that it's not analyzing each company's and securities and determining, do I like this one with investment thesis? It's more, we do transaction to replicate. And it is a popular investment vehicle for foundations because it's also not only it creates a good financial return or has the potential to create good financial return, but it's also the management fees are not quite high. So it is possible to embed ESG consideration into a passive strategies. Many years ago, maybe there wasn't a lot of index or those pools that were integrating ESG considerations in the, crafting of that index, but nowadays there's a plethora of them. So it is a matter of for the hospital foundations to ask investment managers and those responsible for the passive strategies, what are the options out there, and looking at how they can embed ESG consideration. So I think for a hospital foundation that's never looked at this, asking their asset managers, what are they doing, could lead to surprising answers. You could end up, just learning that some of your managers are already doing this. They weren't mentioning it, or it wasn't obvious, so you weren't aware.
Yeah,
Maybe
and
you
as
can
an
add to this.
example of that,
Mhm.
yeah, as an example of that, many asset managers today, for example, they measured what's called the financed emissions in their investment portfolios of the funds. So they basically have a metric that really speaks about, for the money that we are investing in companies, how much of their carbon footprint do we absorb? And many ambassadors will have those indicators, and you can actually see that within a given market that is reflected of many sectors, you will have funds that actually have a lower relative greenhouse gas or carbon emissions footprint than others. So there's a lot of that out there, and asset managers have been doing a lot of really great work over the last few years in really coming up to speed. And just coming back to why I noted about emissions measurement or metrics as something that is being measured, is because sometimes it can be seen as a signal of where you're, how concentrated you are relative to climate risks.
Fantastic. There's a question from Miles. It's a little bit of a departure, but on the slide, on one of your slides, you showed that 41%, or that assets contribute up to 41% of GHG. This person is asking, is there a plan of action to work with procurement to plan the end of hospital life for equipment used?
Okay, so the usual number that you see isn't 41%, it's actually over 60, and that is the UK data from the Lancet study in 2021, pretty exhaustive study. In Laval, Quebec, there was a study done which showed that supply chain might be as much as 80%, incredible, 80%. The American slide, which includes investments, obviously decreases that whole number of supply chain because the Canadian studies didn't include it. So that kind of makes that chunk smaller. So that's the number piece. Interestingly, in the UK study and Canadian study, of that supply chain piece, pharmaceuticals, the production of pharmaceuticals is 25% of the entire pie. So that, so there's a bunch of things that we need to go after. I'll just say what we're doing a couple of things. One, we did 3 years ago, reached out to procurement leads of the big hospitals in Ontario. This is part of the Peach project that I'm involved with, which is an Ontario-based project. And this is the very end of COVID. We reached out and said, hey, do you realize how important you are in this whole climate change solutions? And most of them did not. But we've had a group meets every 2 months. If this is relevant to you, you're welcome to join. Reach out to me. We meet every 2 months. We've done two things. One, some of the hospitals have sent a letter to their suppliers to say, we want green products. Hamilton Health Sciences did this about 2 years ago to 1,000 suppliers. And then step two is to actually put this language into your RFP. So when you are purchasing something as a hospital, you're considering not just cost, quality, you're also considering sustainability or environmental sustainability, and that is happening as well. In terms of I think what you're asking here is single-use plastic stuff. We do have a single-use plastics project. I can point you to the person who's involved with that. But yes, that is a huge part of the solution. We need to move from linear economy to circular economy. Clearly, I could go on and on here, but I'll send it back to you, Ari. But yeah, if that person's interested, just let me know and I can get them connected.
Amazing. And just one last question to finish us off. So one of the biggest barriers was around uncertainty and uncertainty around the financial picture. So how can we reassure boards that sustainable investing doesn't mean sacrificing financial performance?
I can start. I like to quote an academic study because it's a meta study. So it's a combination of many studies that have been done. It's the NYU Stern study about how the impact can be viewed in both companies and funds. And so integrating sustainability in company leads to 58% of the studies lead to positive results when it's company. And when you look at the fund, it leads to 33% of the studies in that meta studies lead to positive. If you add to positive the neutral effect, then you have over 60% of academic studies that lead to positive or neutral effect. But when you isolate, what NYU Stern did was to isolate for climate. So if you were just to forget about all sustainability, just look at climate, the results are very similar for companies, but the results spike for funds. So 43% of the studies in that meta studies lead to positive results for funds, with an additional 22 for neutral. So you're well over 50%. We could probably quote many other academic studies, but we can also look at the actual performance of lead investors. If you look at Canada, for example, the very large administrator managers of pension fund money that we know, like Caisse de dépôt et placement in Quebec, Inco in Alberta, PSP or CPPIB, they're all leaders in integrating sustainability and have been doing so for decades. And the results speak for themselves, I think. Maybe you want to add something, Franziska?
Yeah, I think there's the fundamental belief of most investors is that looking at these considerations really helps to manage downside and manage risks, and it gives that larger perspective as an investor. And many of the investors have done many studies, and one thing too is that the consideration also helps to reduce volatility as well. That's something too that many investors are looking for. They don't want to have huge swings, but you can look at pool of assets, pool of companies who actually have really good fundamental risk sustainability practices. Their stocks will be much less volatile. So if you are a long-term investor, if you're looking for more stable capital, embedding ESG and climate is a good thing.
Fantastic. With that, we finish at 10:59. So wonderful. Thank you so much for everybody for being here today. I'll just put my contact information in the chat if you're interested in continuing the conversation. And then again, we're booking free confidential board, team, or investment committee presentations. So feel free to reach out. We can also have more informal conversations before that as well. Thank you so much. Have a good day.